Hello everyone, a very good morning to one and all. I welcome you to a new episode of Health from Home series by Aditya Birla Health Insurance. I am Dr. Sreelekha, online physician working with M5, a digital hospital which provides healthcare that allows you to consult doctors across India, book lab tests, order medicines, and much more. I'm an MBBS by profession with over 4 years of experience, and I have worked with several COVID-19 patients since the start of the pandemic. As you all know, the new variant Omicron has set off a new wave, and we are all worried about its impact on our health. As the winter season is here, we all get confused whether it's a common cold or flu or COVID-19. I'm here today to clear your queries on COVID-19 and also the Omicron variant, and to help you take care of your health and also your family's health. So in today's Health from Home session, I'm going to answer some of the most frequently asked COVID-19 related questions that I have come across in the past few days. Let's take each question I have been asked one by one. So the first question is, what's the difference between the Omicron and the Delta variant? See, both of these are variants, that is the mutated forms of the original strain. There is per se, no particular difference between the symptoms we have observed. But when it comes to the virus structure as it is, there are a lot of mutations in Omicron when compared to the previous Delta variant. Fortunately, the Omicron variant is less virulent, meaning it's less severe compared to Delta variant. But it is a little too early to comment on the severity because the third wave has set off. We need to wait and watch how severe it can become or how complicated it can become. The next question is, should we get vaccinated to protect ourselves from Omicron variant? Of course, you should get vaccinated. This is the only way you can protect yourself and also your loved ones from the pandemic. See, vaccination per se will not prevent the infection or having mild symptoms. It will definitely prevent the severe disease, hospitalizations, and death. This way, you are developing antibodies and immune response so that if you are infected with the virus, that way you'll be protected from the virus and infection. Moving to the next question. If someone is double vaccinated, can they still get infected with Omicron? Yes, there are chances of getting infected with Omicron variant or any other variant per se if you are vaccinated with double doses. The reason being, as I said in the previous question, if you are vaccinated, you are protected from severe disease and death. But vaccination cannot completely prevent infection or having mild symptoms. So that's why do not think about whether you will have infection after getting vaccinated or not. Do not have all these questions. You will definitely be protected from severe disease and death. It's important to get vaccinated with double doses. Another frequently asked question is, people are confused if they have common cold or flu. They ask me how to know if it is COVID or an Omicron infection. Per se, no doctor can actually diagnose based on your symptoms whether you have common cold or flu or COVID-19 infection. It's the diagnostic test that can help you tell whether you have COVID-19 infection or not. The best is the RT-PCR test, which can diagnose or per se tell whether you have COVID-19 infection. Just based on the symptoms, we cannot say whether you have common cold or COVID-19 infection. Next question is, I was infected with COVID in the previous wave. Will I get it again? Just because you had previous infection or just because you are vaccinated, it doesn't mean that you will not have Omicron infection or COVID-19 infection again. Vaccination and previous infection have proven to protect you from severe disease and death. But reinfections can happen because the virus is changing its structure. Our immune cells may not be able to detect properly. So that's why infection can happen. But just because you are infected doesn't mean that it will complicate or you will develop complications or it will be a severe disease. Vaccines do protect, and also previous infection can protect to some extent, but not completely. Should we take the booster dose? Yes, if you are eligible for the booster dose, I would recommend you to go for the booster dose. For now, Indian government has given guidelines that elderly people 60 years or above have to get booster dose on doctor's advice, especially someone who is with comorbidities like uncontrolled diabetes or hypertension or kidney disease. It's important to actually maintain that optimum immune response to protect ourselves from the emerging variants, which includes Omicron as well. Moving to the next question. Do we still need to do RT-PCR or self-test kits at home are enough? If you have a provision for RT-PCR test, please get the RT-PCR test done. But let's say you are in a locality where RT-PCR is not available right away, or there is no provision to get the RT-PCR test done and you are symptomatic, you want to know whether you are infected with COVID-19 infection or not, then you can go for the self-test kit. But remember, if you have symptoms and if your rapid antigen test or the self-test kit is negative, please contact the doctor, because there are chances that the test might give you a false negative result, which means you might be having the infection, but the test is saying you are negative. Here, in such cases, RT-PCR is the best test. So try to prefer RT-PCR over rapid tests or self-test kits if there is a provision. And whatever is the result, please get in touch with the doctor. Let's go on to the next question. If I have COVID-induced fever, will Dolo help or should I consult a doctor? See, firstly, you will have to get a confirmation that you have COVID-19 infection based on RT-PCR test or rapid test kits, right? So, let's say you are tested positive, you got a report which is RT-PCR positive, all right? So then, yes, you can take Dolo 650 mg, maximum of 4 doses per day. But it's always best to consult with the doctor and take the medication, because the doctor will have an idea on your symptoms, and if there is anything, if there is any severe symptom or if there is any red flag sign or emergency sign, you can just inform your doctor and take necessary action. So please be in touch with your doctor. Except for Dolo, do not take any medication without the prescription or without doctor's advice, because not all medicines are safe in COVID-19 infection and not all medicines are needed in COVID-19 infection or Omicron infection. The next question, COVID positive or not, should we take any supplements like zinc, vitamin C, vitamin D, etc.? See, if you are tested positive or if you are not tested positive and you do not have any symptoms at all, either way, do not take any supplements. During the second wave, Indian government has given guidelines saying that the supplements are not necessary or not a part of the treatment of COVID-19 infection. They are not proven to cure or help in controlling the infection or controlling the symptoms. So it's better to avoid taking these medications without having a document that you are actually deficient in vitamin D or vitamin C. So there's no need to take these supplements. Don't waste your time unnecessarily. Rather than focus on having an active and healthy lifestyle, which will help in preventing contracting the infection. The next most commonly asked question is, how many days do I need to isolate in this current wave? If you are tested positive, from day 1, you need to isolate yourselves for a period of 7 days. And to end isolation, you should not have fever in the last 72 hours without usage of medication. You shouldn't be using paracetamol to control your fever. If that's the case, you can end your isolation after 7 days. If you have a persistent fever beyond 3 days, please get in touch with a doctor. And if anyone has come in contact with you, even they should be isolated for a period of 14 days. They should be under home quarantine. Please note this. The next question is, what are the symptoms of COVID in this wave? Starting from March 2020, when the pandemic was announced, There are a set of symptoms, around 14 to 15 symptoms, which can happen because of COVID-19 infection. With Omicron variant, there are no new symptoms as such. But what we are observing is first headache, fatigue, sore throat, and runny nose. These are the most common symptoms which we are seeing in patients. But we have very limited data based on which we can say that these are the symptoms. If the symptoms are present, then the person is infected with Omicron. We cannot say that. These are the most commonly observed symptoms based on the patient's complaints. Apart from this, a patient can have nausea, vomiting, loose stools, fever, loss of taste and smell. But these are uncommon. The next question is, what more precautions should we take in the current wave? There are no special precautions. These are the same old precautions that we have been following in the past 2 years. Wearing a face mask, hand sanitization, social distancing, and vaccination. Please make sure that you are wearing a mask whenever you step out. It can be a cloth mask, it can be a disposable mask, or it can be a N95 mask. Wearing a mask will definitely reduce the risk of contracting infection. Social distancing. Try to maintain at least 6 feet distance or at least 1 meter distance. This way, there are less chances that you can contract the infection. Hand hygiene. Try to carry a pocket hand sanitizer whenever you are stepping out. It's very important to sanitize your hands, and also ensure that you need to avoid touching your face, especially mouth, nose, and eyes with your hands without sanitizing or cleaning your hands. Vaccination. If you are eligible for the booster dose, please get the booster dose done, or try to finish your 2 doses of vaccination. Only if you finish your 2 doses of vaccination, you are completely vaccinated. If you are done with only 1 dose of vaccination, you are still at risk of contracting infection and having a severe disease. The next frequently asked question, especially from parents, is how do I protect my child from Omicron infection in the current wave? See, children right now are in the susceptible age group because they are not vaccinated. The vaccination trials are still under process. So it will take a while to have vaccination approved for the children. It's very important that we have to protect them. We have to ensure that they are following the safety protocols as well, especially in someone who is about 5-year age group. Make sure they are wearing face masks whenever they are stepping out. But if your child is below 5 years, then it's up to you whether you want to put a mask on them or not. If the child is less than 2 years, there is no need to put on a mask because there are high chances that they may get suffocated. Next, they have to practice hand sanitization, or you need to educate them what is the purpose of hand sanitization. How will it protect us from getting infected? You have to educate your child. Make sure they're sanitizing their hands at least for a duration of 40 seconds. And let them carry a pocket hand sanitizer as well, like us. If they are due for vaccinations, please complete the vaccinations. And if the child is less than 5 years, also include flu vaccination. It's very difficult to differentiate the symptoms in children, and also like adults, they cannot express the symptoms, like they cannot express whatever they are going through. Let it be loss of taste or smell, let it be body pains, they cannot tell us like an adult. So any symptom, any decrease in activity, or if you feel the child is not responding to you properly, or if you feel the child is not eating properly or kind of different from the usual behavior, then please get in touch with a pediatrician immediately. Because not all children will have the classic symptoms of COVID-19 or flu or per se any infection. So try to get in touch with a pediatrician and try to understand whether the child has to be tested or not. Please make sure that you are not attending any crowded places or public gatherings, especially if you have children at home, because they are still unvaccinated and you are putting them at risk of contracting infections. Next, another frequently asked question about vaccination. Can we mix and match vaccines, or is it dangerous? We do not have evidence or scientific data saying that we can mix and match vaccines, especially the ones which are available in India, Covaxin, Covishield, and Sputnik V. We do not have enough data saying that if you mix and match vaccines, or if you mix vaccines, that is going to give you more protection. So do not do that. If you have taken first dose of Covishield, take the second dose with Covishield, and also boosters with Covishield only. If you have taken first dose with Covaxin, please take the second dose and booster dose with Covaxin only. Likewise, the same is applicable to Sputnik V as well. Do not mix until the government gives clear guidelines that we are allowed to mix vaccines, and that is actually safe and also gives adequate protection. It's very difficult for every one of us right now. We thought COVID-19 is ending and we are out of the pandemic, but Omicron variant emerged. With our last question, I hope I have been able to clear most of your doubts and queries regarding COVID-19 infection and Omicron infection. Please, I cannot stress this enough. Do continue to take all the necessary precautions. It will ensure that you are safe, your family is safe, and also the society is safe. If you follow the safety protocols, you're not just keeping yourself safe, you're keeping the entire society safe. You're breaking the chain of transmission. Try to wear a mask whenever you're going out. Do not think that if you don't wear the mask, it's okay. Don't have those thoughts. Please do wear the mask. Let it be anything. You can wear a disposable mask or a fabric mask or N95 mask. Make sure that you're wearing a mask. Though you do not have symptoms, there are every chances that you can spread the infection to others, especially the vulnerable population. Practice social distancing, at least whenever it is possible, and try to avoid crowded areas or public gatherings. We are still in the middle of the pandemic. It's not yet over. It's our responsibility to end this. And try to carry a pocket sanitizer. You can take anything, but make sure that you are carrying a pocket sanitizer, and try to avoid touching your face with your hands without sanitizing. Do not think that Omicron is causing less severe disease so you can get back to the normal life, which we had before pandemic. No. Yeah, it is true that Omicron is causing less severe disease, but it doesn't mean that you can actually get back to the normal life without following the safety protocol. Because there are every chances that the number of infections can rise and it can overwhelm the hospitals. So please don't do that. And we still have the vulnerable population. We have individuals who are with comorbidities and who have compromised immune system, and also children who are not vaccinated. They are still at high risk of developing severe disease and complications. So don't put them at risk. Do follow the safety protocol to keep yourself safe, your loved ones safe. It's your responsibility. Thank you everyone for watching this Health from Home series video. Stay safe, stay healthy.